Shingles is a painful rash. It is caused by the varicella-zoster virus. This is the same virus that causes chickenpox. After you have chickenpox, the virus stays dormant in your body. It can reactivate later in life as shingles. Shingles is not contagious. However, someone with shingles can spread chickenpox. This can happen to someone who has never had chickenpox. Shingles is more common in older adults. This is because our immune systems weaken with age. This makes us more susceptible to the virus reactivating. The varicella-zoster virus is incredibly common. Most people are exposed to it during childhood. This usually happens through contact with chickenpox blisters. After the initial chickenpox infection, the virus retreats. It lies dormant in the nerve cells near your spinal cord. It can remain there for years, even decades, without causing any problems. However, as we age, our immune system's ability to keep the virus in check can decline. This can lead to the virus reactivating and traveling along nerve fibers to the skin. This reactivation manifests as shingles. Seniors are particularly vulnerable to shingles. This is primarily due to the natural weakening of the immune system that accompanies aging. As we get older, our bodies become less efficient at fighting off infections, including the varicella-zoster virus. Stress is another factor that can increase the risk of shingles in seniors. Stress, whether emotional or physical, can further suppress the immune system, making it easier for the virus to reactivate. Certain medical conditions and treatments, such as cancer and chemotherapy, can also weaken the immune system. This makes seniors more susceptible to shingles. It's crucial for seniors to be aware of these risk factors. Shingles typically starts with pain, burning, or tingling sensation on one side of the body. This pain often precedes the appearance of the characteristic rash by a few days. The rash usually appears as a band of blisters on one side of the torso. The blisters are usually filled with fluid. They can be very painful and itchy. They typically scab over within 7 to 10 days. However, the pain can persist for weeks or even months. Other symptoms of shingles can include fever, headache, chills, and upset stomach. It's essential to remember that shingles can affect different parts of the body, including the face, eyes, and mouth. The shadow of shingles. Potential complications. While most people recover from shingles within a few weeks, some may experience lingering complications that can be quite severe. One of the most common and debilitating complications is postherpetic neuralgia, or PHN. PHN is a type of nerve pain that occurs in the area where the shingles rash was located. The pain can range from mild to severe, often described as burning, stabbing, or gnawing. This pain can persist for months or even years, long after the rash has healed. This chronic pain can significantly impact a person's quality of life, making daily activities challenging. Shingles can also lead to vision problems, especially if the rash affects the eye, a condition known as herpes zoster ophthalmicus. In severe cases, shingles can cause blindness, which underscores the importance of early treatment. Other potential complications include bacterial skin infections, which can occur if the blisters become infected. Encephalitis, which is inflammation of the brain, can also occur, leading to serious neurological issues. Additionally, hearing problems can arise if the shingles virus affects the ear, potentially leading to hearing loss. Understanding these potential complications highlights the importance of seeking medical advice and treatment promptly. A shield against shingles. Vaccination. Vaccination is the most effective way to protect yourself from shingles and its complications. Shingles, also known as herpes zoster, is a painful rash that can lead to long-term nerve pain and other serious health issues. Shingrix is a vaccine specifically designed to prevent shingles in adults aged 50 and older. It is recommended for all adults in this age group, regardless of whether they have had shingles before. The Shingrix vaccine is given in 2 doses, 2 to 6 months apart. This 2-dose schedule ensures the best possible protection against the virus. It is highly effective at preventing shingles and reducing the risk of PHN, or postherpetic neuralgia, which is a common and often debilitating complication of shingles. Studies have shown that Shingrix is over 90% effective at preventing shingles. This high efficacy rate makes it a crucial tool in the fight against this painful condition. Even if you have had shingles in the past, getting vaccinated can help reduce the risk of future outbreaks. The vaccine boosts your immune system, providing added protection. Vaccination is particularly important for seniors. As we age, our immune systems weaken, making us more susceptible to infections like shingles. They are at higher risk of developing serious complications from shingles, such as vision loss, pneumonia, and even stroke. Protect yourself and your loved ones by getting vaccinated. Taking charge. Vaccination resources for seniors. Getting vaccinated is a simple yet powerful step towards protecting your health. Several resources are available to help seniors access the Shingrix vaccine. Your doctor's office is a great place to start. They can answer any questions you may have. They can administer the vaccine. Many pharmacies also offer the Shingrix vaccine. Medicare Part D covers the cost of the Shingrix vaccine. Check with your plan provider for specific coverage details. Some local health departments may also offer free or low-cost vaccinations. Prioritizing your health. A call to action. Shingles can be a painful and debilitating disease, especially for seniors. Understanding the virus, recognizing the symptoms, and taking preventive measures are crucial for staying healthy. Vaccination is our best defense against shingles. Do not delay in getting vaccinated. Talk to your doctor about the Shingrix vaccine and whether it is right for you. Remember, your health is your most valuable asset. Taking proactive steps to protect yourself from shingles is an investment in your well-being and future. Hope and resilience. Stories from seniors. In this chapter, we delve into the personal experiences of our beloved seniors who have faced life's challenges with remarkable strength and grace. I always thought shingles was something that happened to other people. Not me, says Helen, a 72-year-old retired teacher. She recalls the moment she first felt the symptoms, thinking it was just a minor issue. But then I got it, and the pain was excruciating. It felt like nothing I'd ever experienced before, a constant burning sensation that wouldn't go away. I wish I had gotten vaccinated sooner. The vaccine could have spared me from this ordeal, and I urge others to take this preventive step. John, a 8-year-old grandfather shares a similar sentiment. He remembers the sleepless nights and the anxiety that came with each new day. I was fortunate that my case of shingles wasn't too severe, but the fear of developing PHN was always in the back of my mind. The thought of long-term pain was terrifying. I urge everyone over 50 to get vaccinated. It's a simple step that can prevent a lot of suffering. It's not worth the risk. The peace of mind that comes with being vaccinated is invaluable. These stories highlight the impact shingles can have on people's lives and the importance of prevention. The emotional and physical toll is significant, but it can be mitigated. By getting vaccinated, you are not only protecting yourself, but also those around you. It's a community effort to keep everyone safe and healthy